All right, welcome. My name is Kimberly Kushner. I am a naturopath and clinical nutritionist specializing in women's health, endometriosis specifically, and I also have a keen interest in POTS and dysautonomia. Before I delve into the naturopathic approach about how we tackle endometriosis, I wanted to tell you a little bit about my personal journey and my story with endo. So I do want to keep this short, punchy, and sweet as to not waste anyone's time and to just get to the crunch of what it is that I want to talk to you about naturopathic medicine and endometriosis. So personally speaking, I got my first period at the age of 11, and from the onset of my periods, they were extremely painful. Now, I had a mother who actually, in my memories as a young girl, I remember seeing my own mother have periods and being absolutely fascinated and at the same time slightly disgusted and a little bit worried, thinking, oh my gosh, am I going to go through this too? And she, of course, said, yes, you are. However, she emphasized to me that, oh, it's not painful. There's no pain. It's not going to hurt. So you can imagine the shock that I felt and the confusion that I felt as an 11-year-old who was experiencing her first period. And in my head, I had this memory of my mom saying, it's not going to hurt, it's not painful. And so that started the journey for me. I ended up in boarding school at the age of 14, I think it was 14 years old. So my mom is Indonesian, my dad's from the United States. I grew up in Bali, Indonesia. Very privileged to have had a wonderful upbringing where I was in a very health conscious household. But I went to boarding school in Australia, and the boarding school was, let me put this in the right terms. So the food at boarding school was absolutely shocking. The health care we received if we were unwell was not holistic in the slightest whatsoever. We'd end up at the school nurse and we'd get taken to a doctor that was affiliated with the school, and that was about it. So I had a horrendous time during my periods at boarding school. I'd miss a lot of school. I'd end up in the sick bay. I became anemic. I needed to go get blood tests every gosh, I think it was at one point monthly to ensure that my iron wasn't dropping too low. So it was a horrible mess. And I've actually created a blog article about this because my heart goes out to teenagers who are dealing with symptoms. And my emphasis is always to look for the root cause of the issue. Now, I had no family support because I was at boarding school, and I was taken to the school doctor, so to speak, who happened to be a man who I knew meant well, but clearly had no idea with what I was going through. So I didn't have an advocate. I had no idea what was going on in my own body, and I was always taken to this one doctor who was hearing me complain without an end about how much pain I was in, how awful my periods were, and I had just been given regular blood tests so to do every month. And from the age of 14, I was put on the pill. I had severe IBS symptoms. I think it was at 15 years old, I did a colonoscopy and gastroscopy, and there was nothing abnormal found. So I started taking omeprazole and Nexium and the pill from the age of 14. And this was my journey for a long time. I was on, so omeprazole and Nexium work to reduce the acid in your stomach. I now know that that wasn't the problem. That was just a band-aid for masking poor gut issues, which was made worse by the imbalance of my gut microbiome by taking the oral contraceptive and the terrible diet that I was eating at boarding school. So I really was not looking after myself. I did not know how to look after myself. And so this is why I'm so passionate about supporting, families with young girls with these sort of issues as well, to give you what I wish I had along this journey. Thinking about it now, it actually really breaks my heart to think that I had gone through this, but it really has shaped me into the practitioner that I am today, in working with the type of people and wonderful patients that I have the privilege in supporting and journeying with. So that's a little bit about my history. I was extremely symptomatic all through my late teens, early 20s. I eventually did come off the pill, and that's when things got really bad. I came off the pill because it made me feel awful. I was also on the NuvaRing. I wasn't given any shots, but I was on different types of the oral contraceptive. And then when I was 23, I went through a horrible flare which lasted a long time. I was in and out of hospital for, I don't know, a lot of times. I was in and out of hospital a lot. I was misdiagnosed. I was told I had urinary tract infections. I was told I had pelvic inflammatory disease. I was told that I had vaginismus, which I knew I had vaginismus, but why did I have vaginismus? Now I know that it was because of the endometriosis and that hypersensitivity to pain, that central sensitization, that tight but poorly toned pelvic floor. So, nobody really delved into the root cause of these issues. I was extremely blessed at the time. So I was in uni and I had a housemate whose father was a OBGYN. However, he lived interstate, but he had connections with who at the time was the endo OBGYN in the state that I was living in. So I got a referral to him, and I had seen so many doctors at this point, and I had been in and out of the Royal Women's Hospital so many times in the emergency department, and nobody talked to me about endometriosis. They saw ectropion on my cervix, which is a sign, which can be a very, prominent sign of endometriosis. No one said anything. No one mentioned endo. So I was blessed that I could get an appointment with this doctor, who happened to be one of the best laparoscopic surgeons for endometriosis, manual excision, wide excision. And he said straight away, I guarantee you have endometriosis. So I was booked in for surgery pretty quickly, and I went in, and yes, we found endo. We found endo on both my ovaries, the outside of my uterus, my bowel, my bladder, and my pelvic ligaments. So this answered a lot of questions for me. I was so grateful that we had finally had an answer. I was so relieved that it now began to make sense. And being the health practitioner that I was and I am, so just a little bit of background, sorry to backtrack and jump around, but I started off as a clinical nutritionist, and then I graduated and went back to study naturopathic medicine. So at this time, I was still completing my studies in naturopathic medicine, but I knew what I was dealing with now that I had my diagnosis. So the doctor was wonderful. He was a great surgeon, and he had a very open-minded approach to dealing with endometriosis. He recommended that I get an IUD, a Mirena, and I said I didn't want to at the time. So he said, look, I'll give you 6 months to work on it, do what you got to do. He was very open to naturopathic medicine, very open to herbal medicine, traditional Chinese medicine, and acupuncture, and of course, good nutrition to support the underlying pillars of my endo symptoms. So he gave me 6 months, and I worked really hard with a doctor of traditional Chinese medicine, as well as all my own personal knowledge, to support my underlying drivers of disease. So for me, stress was a big one. Poor digestion was a big one. And I also had significant inflammation, hormonal imbalances. So we worked on all of that. and I was able to conceive my first son. So he's 10 this month. He's Yeah, so it's been a long journey, but since getting my diagnosis, it's been front and center of my mind to make this my full time. It feels like a full time job, really, just tweaking everything to ensure that I could function at my best. And fast forward now, I have three boys, 1 years old, 3 years old, and 9 years old. I was able to conceive all of them naturally. I'm extremely blessed. Just because you have endometriosis does not mean you have infertility. However, many women with endometriosis will have issues conceiving. That's a whole other conversation. But what I wanted to delve into was I wanted to highlight the key underlying drivers of your symptoms of endo. So when we're looking at pain, when we're looking at bloating, when we're looking at digestive discomfort, fatigue, etc., the main pillars that I address when we're dealing with this naturopathically are firstly, your digestion. So we know that within your within your intestinal tract, you've got significant amounts of microbes. So literally bugs. You've got bacteria, okay? Mostly bacteria, but you've got all sorts of microbes that live in your gut. You may have viruses and fungi. We don't want them to overgrow, though. We want them to all kind of be a healthy, flourishing population that helps to support your immune system, that helps to support your own digestive function, and so much more. We now know that your gut microbiome is linked to your mood. So your gut microbiome plays a huge role in endometriosis. We know that when your gut microbiome is out of whack or out of balance, there will be a predisposition to be more inflamed. We know endometriosis is a systemic inflammatory condition. So you've got these lesions, you've got these growths, whether they be chocolate cysts on your ovaries or peritoneal lesions, which are more superficial, or deep infiltrating endometriosis, or fibrotic fibrotic adhesions, fibrotic tissue. It's all inflammatory, okay? The pain is rooted in inflammation, and also there's a nerve component as well. There's a nervous system component there too. But inflammation. So we know that in endometriosis, you're more likely to have what we call dysbiosis, so imbalanced gut bacteria. There's actually evidence showing that when you have an imbalanced gut microbiome, these bacteria that have overgrown or are imbalanced release what we call a bacterial endotoxin. So toxins, lipopolysaccharides, which drive inflammatory processes. Now your intestinal tract is what we call semi-permeable. So if you imagine like a pipe, and that's your intestinal tract. That pipe, when you think about it in the natural, it's hard. It doesn't let anything through. Now, your gut does let things through. It lets food that's been broken down into its nutritional components to absorb in through your gut wall into your bloodstream, okay? But we know that in endometriosis, when you've got this imbalanced gut microbiome, it can also affect the wall, the lining of your intestinal tract. It can cause inflammation, and things that shouldn't be leaking through the gut lumen, okay, are leaking through into the bloodstream. And this then causes your immune system to recognize something that's in your bloodstream that shouldn't be there. And this triggers a immune response, an inflammatory response. The other thing that we know is that with the scenario where your gut is allowing things to pass through that shouldn't be passing through, so your gut becomes more porous, the cells that line the gut wall become gappy instead of nice and tight. So the bacterial endotoxins that come from the microbes that have overgrown then leak through as well. And you've got peritoneal fluid in your abdominal and pelvic cavity. So this is a fluid that's around your that's in your peritoneum around your organs. And what they found is that in endo, this fluid contains more inflammatory mediators and more bacterial endotoxins. So there's this real inflammatory, hostile environment in which your organs are literally sitting in. So we need to work on sealing up that gut. We need to work on balancing that gut microbiome to make sure that these inflammatory processes aren't going ahead as a result of the imbalance that's happening in the gut and the inflammation that's occurring to make those cells in your intestinal tract more gappy. So we need to make sure it is semi-permeable still, which is how the gut should be. It should be selectively permeable. It should choose the things that come through, but things shouldn't just leak through as they please. Okay, so that's a big thing, your gut microbiome. Now, hormones. Hormones are a huge contributing factor to the symptoms that you experience and to the growth of endo itself. Now, we know that the medical concept of using birth control is to shut down your menstrual cycles to help you with your endometriosis symptoms, to prevent periods from happening, to prevent you from experiencing pain during times of your cycle where you might have peaking levels of estrogen, for example. So by being on birth control, literally shutting down the communication from your brain to your ovaries, which then triggers ovulation and then results in a menstrual bleed. So shutting that off completely. So no judgment whatsoever if you're on any type of hormonal medication. I know that you're on it to help manage your symptoms and manage your pain, but if there was an option which did not involve shutting down your menstrual cycle, may I ask, would you take it? Would you do it? And I think majority of you would say yes, because it's not fun to completely shut down your cycles. It changes you as a person. There are actually other very important there are many important things that result from exposing your body to your natural fluctuating hormonal cycles, whether it be your hair, your skin, your mood, your libido, all these things, okay? And especially progesterone, which is a hormone that we only really get exposure to after we ovulate. By completely shutting down your menstrual cycle, you don't get any exposure to the progesterone that you're producing. And if you're doing this for decades and decades while you're on the pill, you can have some detrimental effects from that. All right. Another thing is, if you're getting depot shots, things like musculoskeletal side effects on your bone density, that's significant. All right. So there are things to consider. There are things to consider when you are on any form of hormonal medication. So hormonal medication isn't for everyone. I managed to stay on it for years, but I didn't feel great. I didn't get any major adverse reaction like clots or anything like that, but it just made me feel really unlike myself. It affected my moods, affected how I felt in my body. It affected my digestion significantly because the pill can definitely affect your gut microbiome. So estrogen itself, the lesions itself, are like little estrogen producing factories. Now we know that estrogen in excess can drive your symptoms of endometriosis. Now, it's not just as simple as that. Now you have 3 different forms of estrogen, E1, E2, E3. Your estrogen is metabolized through your liver predominantly in the initial phase of liver detoxification. So phase 1, your body will convert your main estrogens into estrogen metabolites. Now there are specific pathways by which these estrogen metabolites should go down. Imagine like different lanes down a highway. They should go down there in different lanes in different amounts in order to optimize estrogen clearance. So you want to clear estrogen really well. You don't want it banking up. Imagine these laneways that you don't want them to cause traffic jams, essentially. And if too much is going down one pathway and not enough going down another pathway, this can result in your more proliferative forms of estrogen metabolites forming. So these more proliferative forms can create more estrogenic symptoms that cause your endo lesions to grow, that cause you more pain and more symptoms and more discomfort. Okay, so your endometriosis lesions are not the same as your endometrium. So your endometrium is what's lining the inside of your uterus and what comes out during your periods. Now, these are made out of glands and stroma, which is like your endometriosis lesions, but your endometriosis lesions are different. They behave differently. Hormonally, they respond differently. They create their own aromatase enzyme, which, for example, has the ability to convert your androgens like testosterone into estrogens. Okay, so they are like their own estrogen producing factory, and as a result you're going to get more inflammation locally, and that explains why we can have so much localized pelvic pain or gastrointestinal pain depending on where your lesions are. All right, and then that referred pain down the leg as well, if it's near nerves like your sciatic nerve, for example, which I know I experience a lot of. All right, so I hope this is making sense. So from a naturopathic perspective, what we want to do instead of shutting down your cycle completely is ensuring that the estrogen metabolites are getting diverted down the specific laneways that they're supposed to go down in order to create the form of estrogen metabolite that is going to be easily neutralized for your body to excrete. So there are different estrogen metabolites, like I mentioned earlier. Some are more proliferative, some are more protective. So we want majority of your estrogen to be detoxified to become the more protective metabolite. Now in endometriosis, this isn't always the case. All right, so instead of shutting down your cycles completely, we want to make sure that you're creating more of the protective estrogen metabolite and that you're detoxifying through the appropriate laneways and the appropriate pathways, and this is done through the liver. So we can test for this. We can see where you're metabolizing and what is being metabolized and how much of each metabolite you're creating. And we can use herbal and nutritional medicines to support the correct pathway. All right, that's wonderful. Unfortunately, pharmaceutical medicines do not have the capacity and the ability to do this. By shutting down your cycle, you're just reducing estrogen levels overall. But I do want to say there is definitely evidence that the pill or shots, like depot shots, do not stop the growth of endometriosis. They are still there. They can change the way they look. For example, they can present differently, but they can still be there. You can still have growth development of endometriosis lesions even while you're on the pill. Okay, so that's something to be very mindful of. So where were we? Phase 1. So phase 2, after you convert these estrogen metabolites, you then convert it into, you undergo phase 2 detoxification so that you can convert these metabolites into a neutralized form of estrogen so that you can excrete it through your bowels, for example. You also excrete some through your urine. But this phase 2 detoxification relies on a process called methylation and specific enzymes that rely on methylation. So methylation is a big process in your body that requires methylated nutrients like methylated folate, methylated vitamin B12, B6, in order to support the phase 2 detoxification. Now, in some people, methylation can be a little bit slower, so you're not going to be as effective at doing this second phase, and then you can get a bank up of the first phase of estrogen metabolites. So we want to make sure we're supporting both phase 1 and phase 2, and then phase 3. So what happens next is that your estrogen gets dumped by your bile into your intestinal tract, and then it comes into contact with your microbiome. Now you've got a population of your gut microbiome, which is called your estrobolome. Now your estrobolome is responsible for estrogen metabolism. So estrobolome secretes an enzyme called beta-glucuronidase. And when your estrogen reaches your intestinal tract, it's nicely conjugated and packed together. And when it comes into contact with your estrobolome, which secretes your beta-glucuronidase, it can often, if you have an overgrowth of the microbes that secrete beta-glucuronidase, it can unpack the nicely packed estrogen. And then what happens if you're not excreting, if you're not going to the toilet and moving your bowels and having regular healthy poos, is that that secretion of the beta-glucuronidase enzyme deconjugates or unpacks. So imagine estrogen is nicely packed in a little present. It opens it up and it allows estrogen to be absorbed into your bloodstream again. So it's called enterohepatic recycling. So it gets absorbed from your intestinal tract back into your bloodstream, back into your circulation, systemic circulation, and then estrogen elicits its estrogenic actions and causes symptoms again. So what we want to do is ensure that there is no overgrowth of microbes, because what we mentioned earlier, the endotoxins, but also beta-glucuronidase, the enzyme that can unpack that estrogen and encourage the recycling. We don't want that to happen. We want estrogen that gets to this point nicely packed. We want it to be cleared out of your bowels. So this is why gut health is so important when we're dealing with endometriosis, because this whole process of of detoxifying, metabolizing, and then excreting your estrogen is so super important, okay? And then what can happen is, if your estrogen isn't being eliminated effectively and then it gets recycled, or if you have higher than health, normal healthy levels of estrogen, is that you can have this situation where your progesterone levels are too low in comparison to your estrogen. So there is always going to be higher levels of estrogen than progesterone. We also measure them in different units, but it's going to widen that gap. It's going to cause this dramatic difference, especially if you are also more prone to lower levels of progesterone. So if you're not ovulating well, or if you are ovulating but that luteal phase, the second phase of your cycle, isn't very robust and you're not producing good levels of progesterone from that corpus luteum. So that corpus luteum is that little sac that your mature egg gets released from when you ovulate. So it's a responsibility of that teeny tiny little corpus luteum, that little scab, to produce and secrete good levels of progesterone to last you a good luteal phase, to make sure that your levels of estrogen are being met by this antagonistic progesterone so that you're not as symptomatic. So this is when I talk about hormonal balance and optimizing hormonal metabolism for dealing with endometriosis. So that's another really important pillar that we address. Immune system. Okay, so we know that your immune system plays a huge role in the metabolism and the formation of endometriosis lesions. There are many theories. There's the theory around how endometriosis is formed, and the theory of retrograde menstruation, for example, where people hypothesize that your menstrual fluid was regurgitated backwards in through your fallopian tubes and then implanted in your peritoneal cavity. So that's one. There's the theory of malarianosis, where it's said that when you are being formed in utero, that these cells don't differentiate properly, and you are actually growing endometriosis from when you are in utero. So there are different theories around the etiology or the cause of endometriosis, but it's still really unknown. But there are many, many compounding factors that drive the root causes. We know that, as I mentioned before, the gut, your microbiome, your hormones, this will all drive endo symptoms, progression, etc. So we're going to focus on what we do know. But back to your immune system. So it's the job of your macrophages, which is an immune cell. Your macrophages actually work on immunosurveillance. So it's like they are looking out for cells which shouldn't be where they are, and it's their role to mop it up, clean it up, get rid of them. So for some reason in endometriosis, macrophages aren't doing their job properly. They're not effectively doing their immunosurveillance tasks. So these endometriosis cells are getting past these immunosurveilling I don't even know if that's a word, these macrophages that are meant to wipe out, clean up these endo cells that are getting into the wrong places. So there's this immune dysregulation. We know that nutrient deficiencies, for example, can drive immune dysregulation, like vitamin D deficiencies, for example. Endometriosis is not proven to be an autoimmune condition, but there is immune dysregulation involved in the formation of endometriosis. So we look at your overall immune function as well and how you're going. Usually there's a lot of inflammation. Excuse me. And in talking about inflammation, that's another major pillar which we address when we're dealing with endometriosis naturopathically. So inflammation is what drives pain. Okay, so inflammation and pain go hand in hand. Inflammation is a process that our body actually really does need. It is something that our body kicks off when there's any sort of injuries, because we need those inflammatory processes when there's any hurt, any wounds, any injuries, to kind of like bring your immune cells to an area, drive up inflammation to start the healing process, essentially. But when it is chronic and when it is out of control, this is when we see, this is what we see in endometriosis, and this is what translates into the symptoms that you experience. So what we know is that there are natural ways to downregulate inflammation. So this is when diet can play a huge role. And we look at eating an anti-inflammatory diet or a low histamine diet, because back to immune dysregulation, we often see a link between high histamine intolerances with the estrogen link. So high histamine will liberate, the histamine will increase the estrogenic symptoms, right? So worsen your PMS, worsen your pain, that kind of thing. So by reducing our histamine intake through food and supporting the way that we metabolize histamine and get rid of histamine, we can help with some of the estrogenic symptoms. So I often use a low histamine diet in clinic. And I find that can significantly help with digestive symptoms as well as any systemic inflammatory pain and symptoms. All right, so immune dysregulation, inflammation, very closely linked. We know that there are other natural ways to downregulate inflammation. So looking at your essential fatty acids. So in our body, every cell has a lipid membrane, a fatty wall, essentially. And the cell wall is made out of little lipids, little fat cells. But the fats that are used to create your cell wall are going to be determined by what fats you have in your body, what fats you're eating. So most people are eating way too much omega-6 fats and not enough omega-3. You may have heard that omega-3 is anti-inflammatory, and it is. It is a potent natural anti-inflammatory. But unless you're eating good amounts of oily fish weekly, it's highly unlikely that you're going to be having enough omega-3 to elicit an anti-inflammatory response in endometriosis. So I do omega-6 to 3 ratio testing, as well as look at your other essential fatty acids. So we look at some of your saturated fats, we look at your omega-9s, but mostly omega-6 to omega-3, and we really want your omega-3 index to be above 8% to ensure that you've got a good amount of omega-3 in your, not just in your bloodstream, but actually permeating that cell membrane. Okay, there's a difference. The other thing I want to say is that your omega-6 to 3 ratio should be between 3 to 1 and 1 to 1. So on average, I'm seeing people get around 15 to 1. That means you're having 15 times as much omega-6 as you are having omega-3. You should only be having 3 times as much omega-6 as you are omega-3, or the same amount, or double. So 3 to 1 to 1 to 1. Omega-6 drives up inflammatory pathways more than omega-3s. Omega-3 has an anti-inflammatory action, whereas omega-6 is more your pro-inflammatory pathways. So omega-6 starts up a process from what we call the arachidonic acid pathway. Okay, you've got your COX and LOX enzymes. So these enzymes, if these enzyme pathways are activated, they will result in the formation of inflammatory chemicals, so inflammatory cytokines, inflammatory mediators. Okay, so by ensuring one of the easiest ways nutritionally that you can have a handle on your inflammation is to correct your omega-6 to 3 ratios. You want it to be between, again, 3 to 1 and 1 to 1. So we don't guess. We want to make sure that we test and that we ensure that your levels are well within this zone. Okay, and then there are other things that we can use to suppress and manage inflammation as well, like polyphenols, plant chemicals that have an action where they protect your omega-3 from oxidation. Because if we think about it, our body is undergoing reduction and oxidation all the time. But in a very pro-inflammatory environment, like the endometriosis lesions and endometrial pelvic cavity in someone with endometriosis, it's probably going to be a lot more inflamed than someone who doesn't have it. Like I said before, in the peritoneal fluid of endometriosis patients, there is a lot more inflammatory markers, inflammatory chemicals, bacterial endotoxins. So it's a hostile and inflammatory environment. So we want to make sure that we are doing what we can to downregulate inflammation. And by addressing your omega-6 to 3 ratios, that is something that we can do very effectively nutritionally, that we can do without guessing with test-based nutritional strategies. So what I've covered is your digestive system is really, really important. We need to address your gut. We need to address your gut microbiome. We want to support hormones and ensure that you are metabolizing, detoxifying, and clearing hormones effectively. Your gut is linked to that very closely, okay? Your liver and your digestive tract and your gut microbiome. We also know that your immune system needs some TLC because in the formation, in the growth and proliferation of endometriosis, there is a dysfunction of your immune system whereby your macrophages aren't looking after and doing its immunosurveillance activities effectively. These cells are getting past them for some reason. Okay, we also know that there is potentially a histamine link, which is linked to your immune system. Histamine is an inflammatory cytokine, inflammatory mediator that lives and is housed by your mast cells, part of your immune system as well. When there's lots of inflammation or you have too many mast cells, these mast cells will pop, degranulate, and out comes histamine along with other inflammatory chemicals. So we want to stabilize those mast cells. All right, and if you have an issue with histamine, we can look at a low histamine diet, supporting your histamine metabolism pathways with enzymes like diamine oxidase. We can look at your genes that code for the enzymes that break down histamine, like your DAO and HNMT. DAO in the gut, HNMT in your nervous system. If you have glitches or single nucleotide polymorphisms in these genes, you may be less able or less effective at breaking down and eliminating histamine, which can be a big contributing driver to your endo symptoms. So as you can see, just based on this conversation, your endometriosis symptoms have various root causes and drivers that can be very easy to overlook if all you're doing is using pain medication and hormonal birth control to manage, because there are things that aren't being addressed, like your immune system and your gut and your microbiome and this and that I mentioned. So I'd like to give you an opportunity to jump on a call, a complimentary call, and chat to me about what's going on with you. Tell me a little bit more about your health story and see if we're a good fit to work together, essentially, because there are so many things that we can implement to help you with whether it's endobelly that you're dealing with, and that bloating and that discomfort and the IBS, oh my goodness, have I been there? The pain, the heavy bleeding, not to mention that a lot of you may have both endometriosis and adenomyosis. Okay, that's certainly what I had and what I have. I came out of my surgery and my doctor showed me photos of my extremely bulky uterus, which means that it is a very classic sign of adenomyosis because of that real thickened myometrium. Okay. So I want to give you an opportunity, jump on a call. It's a complimentary call, completely obligation free. But if this is the change that you need to tackle your endo symptoms by addressing the underlying drivers, which I have just gone over, then we need to talk, because it's time that you do things differently. And if you're on the pill or on any form of hormonal birth control, there is absolutely no pressure whatsoever to come off it. There are many things that we can do in the meantime to help with, if it's gut symptoms that you're experiencing, if it's fatigue, if it is migraines, you're still systemically inflamed, you may still have nutrient deficiencies, you may still have a dysbiotic gut microbiome. All of this stuff we can talk about and address. So if you think that this is for you, and if this resonates with you, then let's talk. And I would be honored. It would be an absolute privilege for me to walk and journey alongside you to give you the support that you desire and that you need in order to eradicate endobelly, tolerate more foods, reduce pain, lessen your bleeds, improve your energy, and so much more. Thanks for joining me, and I'm really looking forward to speaking with you soon.